In this lesson, we're going to look at immunizations. And I'm sure you have this really solid understanding of what immunizations are. But in this lesson, we're going to focus on how immunizations actually play into how we take care of our patients. And the first question you're probably going to ask is how do immunizations deal with safety? Well, it's about the general community safety and how we deal with protecting the general population against different types of illnesses that are associated with like different bacteria and viruses. And we can do that through the use of immunizations. And when we use them appropriately, we can actually help those who are unable to actually receive vaccines. Vaccines are a primary prevention. So there's a good lesson on different levels of prevention. So be sure to go check those out. And we also need to remember how vaccines and immunizations work. You're actually triggering the immune system. You're stimulating by introducing small bits of bacteria or viruses, and you stimulate the immune response, and it actually creates a defense mechanism and a way to protect itself. For the most part, schools and universities follow the AAP, which is the American Academy of Pediatrics, and also the Centers for Disease Control. And what they do is they help guide immunization policy for these types of entities. And because what they also want to do is protect the general public, and they do that through active immunity, which is kind of what we talked about here when you're stimulating the immune system. The other thing that it does is by promoting the use of immunizations, you focus on something called herd immunity. And what herd immunity is if you have this one patient that can't get shots because they have or immunizations because they have leukemia or some other autoimmune disease. Well, imagine if you have all these people out here and they're all immunized. What they do is they create this barrier so that this one patient in the middle is protected. So you've got your bacteria, and they're mad and they want to come attack him. Well, they can't because these people are protected, and because these people are protected, they're actually helping this guy out right here. So that's what herd immunity is. And by keeping everybody else healthy, those people that can't get immunizations they stay healthy too. They're also required by healthcare providers because we're exposed pretty frequently to different types of crazy bugs like Hep A, Hep B, Hep C, the flu. By getting immunizations, we actually protect our patients because we're already protected, and we have a decreased likelihood of transmitting some sort of disease to them. So now that we've hit some high points on vaccines, let's take a look at some different types. There are 4 different types of vaccines. You have live, killed, toxoid, biosynthetic. Live or an attenuated vaccine. And the way these work is they take live snippets or little pieces of the bacteria, and they're actually in the vaccine. And by doing it, it stimulates an immune response. Stimulate an immune response, and you create something called an antibody. And this antibody, so let's say your MMR, so let's say measles, mumps, and rubella. Measles, mumps, and rubella are a type of live or attenuated vaccine. And so what happens is, let's say you're exposed. Well, because your body has already built up these antibodies, it actually goes and kills and destroys the virus. Varicella, chickenpox is another type of live immunization. Now, there's some that are called killed vaccines. They contain snippets as well of the types of bacteria or virus, but what they do is either through formaldehyde or heat, they will actually destroy the virus. So it's actually an inactivated portion of the virus, and it still does the same thing, stimulates the immune system, and then you in turn create antibodies. Pertussis is a good example of a killed or inactivated vaccine. Toxoid vaccines are immunizations, and they're used they're created from the toxin from a bacteria. So you have tetanus is a toxoid type of immunization. Diphtheria is another one. Because science is so super cool and awesome, we're actually able to manufacture biosynthetic vaccines, and they are man-made. And what they do is they provide another avenue for making immunizations available. A good example of a biosynthetic vaccine is Hep B. So now that we've checked out the different types, let's look at immunization safety. The general consensus with vaccines is that they're generally well tolerated, and the benefits far outweigh any risks associated with getting them. There are risks to consider. Age, medical issues, those are reasons that you might consider not giving an immunization. The CDC, like we talked about earlier, and the American Academy of Pediatrics both have national guidelines for vaccines, and they help influence state and school vaccine schedules. So you can always refer to those. So what are the current guidelines? Well, CDC and AAP put those out. All immunizations carry some risk, but like I said, the overall benefits far outweigh the risks in any case. There are some contraindications. So diseases like AIDS or leukemia, those would be a contraindication or something that you would definitely have to talk to a provider for. The other one is pregnancy. We have to be considerate of all our pregnant population, because not all immunizations are safe for pregnant women. So the best thing to do is, if you get cases like this, hey, I have some sort of contraindication or some sort of concern, defer to your provider. Just make sure, hey, is this consistent with the CDC? Was consistent with the AAP? What are the inherent risks? What are these contraindicated? I really should defer to my provider for, hey, do we really want to give this considering X, Y, and Z? So just always defer to your provider if you have any sort of concerns. When we give immunizations, we also want to make sure that we're educating the patient. So this is really focusing on our concept as a nurse, like how vaccines play into what we do as a nurse. So we want to focus on our education. Hey, these are common side effects. Swelling of the site, may be painful for a couple of days, not a big fever, or not a big deal. Speaking of fever, sometimes you can actually run like a low grade fever. It's not a big issue. Serious side effects, I'm talking like breathing issues, chest pain, like things that we would maybe present to the emergency room for. These are serious side effects, and every immunization is going to have like an info page, which you'll provide to the patient. And so those side effects will be on there. Make sure that you have consent. Make sure the doctor is, hey, you need to get this immunization, and this is why. And that's really a conversation for the doctor, but just make sure that, hey, I'm about to give you your flu shot. Do you understand I'm giving you your flu shot, right? That's okay, cool. Then also follow your sick patient rights. You've got, just to go over them, you've got right patient, you got the right drug, you got the right route, you've got the right time, and you've got the right dose. Oops. And you've got the right documentation. Immunizations don't fall into their own category of not doing these six patient rights. You still have to do that. So you need to make sure that these six things are all in order before you give your any of the immunizations to the patient. Again, appropriate site. Make sure the site's appropriate. The deltoid is a really common area to give it. Make sure you're giving it in the deltoid. One time I got a flu shot in the tricep, and that thing hurt for days. So make sure that you're giving it in the right spot. Also, watch for any immediate reactions that you should be concerned about. Most people tolerate them really well. Intervene when necessary, and just make sure that you're using good nursing judgment. Remember, this lesson is about general safety to the community. So we're talking about safety here, but we also focus on immunity because we're building immune responses through immunizations. So for our recap, we want to focus on education first. Make sure you educate your patients and families on what immunizations they need, what immunizations they're getting, what they'll need in the future, what to expect in terms of side effects. Make sure that you're telling them about what serious side effects that they need to watch out for. Why do you need to go to the hospital? That kind of thing. Know your different types. Know whether the vaccine you're giving is a live killed toxoid biosynthetic. This actually plays into things like when you're giving a TB test. If you're giving a TB test, you can't have had a live vaccine in the past like 4 weeks. So this is why it's important to know, hey, I'm giving this and I need to tell the patient what I'm giving. So just make sure that you know the type that you're giving. Also watch for reactions. Most side effects are mild, but just watch out some rare instances. The patient can have some sort of reaction to it. So just be on the lookout for that. Remember, immunizations are a type of primary prevention. So again, go check out that cool lesson on different levels of prevention. And in any questions that you may have in giving immunizations to your patients, always defer to your provider. Bring in the healthcare provider if you need to. So that's our lesson on immunizations. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.